Let's bring in Dr. Mads Gilbert now, a professor of emergency medicine at the University of Tromso, Norway. First of all, thank you very much for your time. Now, you've trained and worked alongside doctors in Gaza for the past 20 years. What's your reaction to the Israeli military's systematic or apparent systematic targeting of Gaza's health system time and time again?
I'm shocked, but I'm not surprised, because all of us who have been working over the years in Gaza and also in the West Bank, we know that the Israeli occupation forces have, as part of their operational plans, to attack healthcare, and not only hospitals, but also ambulances, primary healthcare centers, and other health facilities, and the supply lines. So this should not be new to neither the governments of Europe nor to the WHO or the US, because Israel has been allowed to attack the healthcare system, in Gaza in particular, for many, many years, and it's very well documented. What we are seeing now, however, is unprecedented. It is so brutal, it's so barbaric, that sometimes when I wake up in the morning, I have a hard time understanding that I live in 2024. When is this going to be stopped by responsible governments who says that USA has to stop Israel? We are watching full screen live coverage of a massive abuse of human lives, of healthcare systems, and war crimes in the making. And we are watching live a genocide where part of the focus is precisely to deny the Palestinian civilian population healthcare, so that if they are not killed by the bombs, they're either killed by the complications to their wounds, or to their diseases, or to starvation, or to lack of clean water. It's very systematic, it's very deliberate, it's extremely cynical, and it's a crime against humanity.
Now, you must know many of the staff that are working at these hospitals under repeated Israeli attack. Are you in contact with them, and what are they saying? And indeed, do you know Dr. Hussam Abu Safir, the director of the Kamal Adwan Hospital?
Yes, I am in contact with them regularly, almost daily. I am in contact with my respected colleague, Dr. Youssef Aburish, who is the Minister of Health, the Deputy Minister of Health in Gaza. And I also am in contact with my clinical colleagues in the various hospitals, like in Al-Aqsa and Nasser Hospital. These doctors, these nurses, these paramedics, and not to forget these medical students, the Palestinians, are doing a very important, heroic work to keep up some sort of healthcare for the Palestinian people. What they are saying is, how is it possible that the world is standing idly by and watching this day by day? Because, as they say, the world leaders have all the facts, all the reports, and we have been yelling and screaming and discussing about the healthcare and the conditions for the civilians in Gaza for 14 months now. Everything is known, and yet, as of today, we see Palestinian children freezing to death in 2024. So what they are saying is that, why is there all this double standard? Why is this allowed against us when it is not allowed in Ukraine, for example? So I think they are very right in pointing to this very disturbing, very, very prominent double standards, which I would call racism, that a Palestinian life, a Palestinian baby who freezes to death isn't even worth a number or a name in the Western media. It's more like a phenomenon. And don't forget that before the 7th of October, the poverty level in Gaza was around 70% because of 17 years of siege. So all the kids in Gaza now, they have summer clothes. When the rain, the wind, the storm, the cold temperature comes, they don't stand a chance in these tents without any source of heating. And all of this is deliberately engineered, planned, and executed by the Israeli occupation forces with the full support of the United States. It could be stopped in a second with a ceasefire, with an opening of the siege, and an all opening of the entry of humanitarian support. Why isn't that happening? Why is there no state leader going to Gaza personally and standing in Gaza and saying, stop it?
Dr. Gilbert, you mentioned there of the world standing idly by. What if these were Israeli hospitals? What would be the reaction then? How different would it be?
We all know, the UN reports sum up that more than 1,000 Palestinian healthcare workers have been killed in Gaza so far by the Israeli occupation forces. You can only imagine what would have happened if 1,000 Jewish medical workers in Israel had been killed in some sort of foreign hostile attack on Israel. You can only imagine what the reaction would have been if one, if not 14 hospitals in Israel had been attacked by foreign forces and destroyed. You can only imagine if one Jewish toddler in Israel had frozen to death due to a siege of the city they lived in, due to a deliberate lack of water and heat and electricity. And this is sickening, because this is what we said in 1945, never again for anybody, no more genocide. And the genocide declaration and laws were made after the Second World War to avoid another genocide. And now it is the people who were genocided who are genociding the Palestinian people. So these are very difficult times, and I'm actually very puzzled and shocked by the lack of leadership among European government leaders, presidents, and prime ministers.
Dr. Mads Gilbert, we really appreciate your time. Thank you for speaking to us here live on TRT World. Speaking to us live there from Oslo in Norway, Dr. Mads Gilbert.